Dr. Akanksha, and I will be taking your class on assessment and diagnosis of addiction today. I can see that there are 13 participants, so that means around 11 doctors have joined. I would really appreciate it if it can be an interactive session. If you have at any point you have any questions, maybe you can write them down, or you can just raise your hand or unmute and ask immediately. So it is always better to clear your doubts right there and then so that it might benefit others also. So the scope for the presentation today will be we'll just do an introduction, we'll do some need for the assessment, purpose of the assessment, diagnostic criteria. So in psychiatry, usually we follow two schools of thought, either ICD, which is the International Classification of Diseases, or the DSM. So usually the ICD system is followed in most countries, including our country. DSM is usually a USA based system, but some people for research purposes might also prefer if you code DSM as well as ICD. But as far as it's concerned about the insurance or it's concerned about billing, ICD is most widely accepted in most countries except the US, where DSM is the one which is more widely used. So, what are the types of assessment? After that, we'll come to the types of assessment. So, when we say we have to assess whether the patient is having an addiction or not, we can do a clinical assessment, we can do a detailed history, some physical examination, some mental state examination, laboratory assessments, and instrument-based assessments. And in the end, we'll see some special cases. So, if we are trying to diagnose or understand the process in some special cases, we will look at that. So in my I had one previous session as well, during which I just brushed up on what is addiction, what do we mean by it, and how the cycle of the addiction goes. So you can go back and see that as well. If there is still any doubt, you can always email me, or I would be more than happy to take questions. Why do you think that we need to assess? So, studies report that despite an estimated lifetime prevalence of 10.3%, substance abuse dependence is not you routinely underdiagnosed. So, this statistics is mostly I have taken from the Indian point of view. So, of course, if you see how it is abroad, it will be even more different. So, because what happens there is the availability, the rules, the regularizations, and the cultural aspects are quite different, right? Here also, it is somewhat acceptable. For example, I'll say that in Canada, in Australia, in a few other countries now, marijuana is legal. So the diagnosis there, if they do even think about diagnosing a patient with cannabis addiction, people will be more forthcoming as opposed to our country where there might be a dependence, there might be an addiction, but people are not forthcoming. So we are not able to diagnose it and we miss out on it. It's very, very important here is also to understand that when I say I want to talk about substance, when I want to talk about addiction, it's not just psychiatry, it's all branches. Hardly you will, I am not sure here if there are people from other branches as well. So you won't get a patient in surgery who's come to you with, say, pancreatic cancer, who has come to you with cirrhosis, or the same person has gone to medicine, and the underlying cause is actually addiction because they've been taking alcohol for a very long time, and that is the reason the etiology is going that way. So unless you also address this, whether it's you are the one who's addressing it or whether you are referring them to a specialist, a psychiatrist, it will not be taken care of. So just taking care of the superficial thing without actually thinking about the etiopathogenesis, it becomes very difficult. So it has been found that the prevalence of substance use is greater among people with mental illness as compared to the general population. Now, this statement is very, very important. Why I want you to know this statement is for two reasons. And reason number one, people with mental illness, people with psychiatric illnesses are so still stigmatized in our country, in countries abroad, that they, again, when they come to you, you will.
Addiction is not a lack of willpower. It is a medical disorder. It changes how the brain controls reward, motivation, and decision-making. Diagnosis begins with a detailed clinical interview and behavioral assessment. Key symptoms include loss of control, intense cravings, tolerance, and withdrawal. Doctors use standardized diagnostic guidelines such as DSM-5. Medical tests and mental health evaluations help rule out other conditions. Early diagnosis leads to effective treatment and long-term recovery.